Hello and welcome. My name is Dr. Birgit Wolgatsky. I'm biologist and nutritionist, and the focus of my work is lifestyle and nutrition when planning for pregnancy. When it comes to endometriosis, a big question for many women is, how about my fertility? Does endometriosis affect my fertility? And the good news is that we know today that roughly 50% of patients with endometriosis do not experience any problems whatsoever with natural conception and pregnancy. Women who do experience problems, for them very often a first step will be to have a look at where the endometriomas are located. Imagine, for example, if you have endometriomas in the area of your fallopian tubes. This can lead to inflammation, can lead to blockage of the fallopian tubes, of course, making natural conception difficult. Then micro-invasive surgery can be very helpful to achieve natural pregnancy. For some endometriosis patients, still conception may be difficult. This can be due to the fact that endometriosis is also associated with changes of your hormonal system. Very often we see estrogen dominance. This does not necessarily mean that there is actually too much estrogen, but it means that estrogen in comparison to progesterone is too much, too visible, too active. Estrogen has been found not only to promote progression of endometriosis, but also to interfere with hormones that regulate our female cycle. This is the reason why in some endometriosis patients we see that the development of the oocyte faces difficulties. So women usually ovulate fewer oocytes. Another problem is that the oocytes that are ovulated sometimes show diminished quality. The problem lies in inflammation and increased oxidative stress that is associated with endometriosis. Then the patient herself can support her oocyte quality by sticking to an anti-inflammatory diet and by supplementing antioxidants to gently lower oxidative stress in reproductive tract. This will also help semen, because we know today that not only oocyte quality suffers from an environment that is very oxidatively stressed, but also spermatozoa have difficulties in performing their huge task of reaching and fertilizing the oocyte. Now, once pregnancy has occurred, many women wonder, what about the pregnancy? Are there any specific difficulties to be aware of? And the good news is, most of you will experience your pregnancy as a wonderful time with very little endometriosis symptoms. Also, the risk for any pregnancy complications isn't much higher than for any other woman. The only difference is you have a slightly increased risk of so-called placenta previa. That means the location of the placenta can be a bit different and may lead to the choice of a cesarean section as the best delivery option for you. Discuss that with your doctor. You are in the best hands there. However, we know today that a big proportion of pregnant endometriosis patients have a very normal, very good delivery without any problems. Only their risk of losing a little bit more blood than other women is elevated, but also not in a way or in an amount that raises concern. Simply make sure that after delivery, when you also start breastfeeding, you may take a supplement during breastfeeding anyway. Choose one that has a small proportion of iron to help you rebuild, replenish your blood supply again. I hope this information has been helpful for you. I keep my fingers crossed and hope you will soon be pregnant and wish you all the best. It would be nice if you chose to come back to our channel another time for more information, and bye bye.